Our final bill for this part of the day is House File 1438 from Chair Bang. Chair Bang is not a member of our committee, so I will move to refer House File 1436 to the Human Services Finance Committee. I also understand, Chair Bang, that you have a A2 authors amendment. I will move the A2 author amendment if you'd like to explain that to us, please.
Thank you, Mr. Chair and members of the committee. The A2 amendment is just makes technical changes and adds eligibility for the supervision grant program.
Very good. Any questions on the author's A2 amendment? Hearing none, all in favor of approving the author's A2 amendment signify by saying aye. Aye. Opposed? Motion carries. We approve the A2 amendment. So, Chair Bang, if you'd like to explain your bill as amended, please.
Thank you, Mr. Chair and members. This is a workforce bill. As some of you may already know, addressing shortages in the mental health workforce has been a priority of mine for a number of years. It's not news, as mentioned earlier, that we are experiencing a severe shortage in the mental health workforce and a male distribution. With increased needs, we need to increase our workforce. Mental health providers are significantly underpaid compared to other providers with the same level of education, preparation, expertise, and licensure. Between 2007 and 2014, only about 49% of those completing their graduate education to become a mental health professional actually obtain their license. We also know that 88% of our clinicians are white. The past 2 years, I've carried bills to address both the numbers of people in our mental health workforce and its diversity. We increased funding for the Mental Health Professional Loan Forgiveness Program, paid for BIPOC mental health professionals to become supervisors, provided grants to providers treating people from underserved communities so they could provide supervision for free, and allowed supervision to be conducted virtually. In addition, we now require mental health professionals to take continuing education to become culturally informed, and we require the boards to have diverse membership. And lastly, we created the Culturally Informed and Responsive Mental Health Task Force to continue to study this issue. And I want to thank the committee and the legislature for their support on these initiatives. And this year, I have introduced House File 1436 to build on this work by continuing funding for the 3 programs I've just mentioned, and to ensure that under the MERC program, providing care in the community is allowed, creating a pediatric primary care mental health training program, creating a Grow Your Own program to support people in obtaining a master's degree, creating a training program for people working with youth with a mental illness, and funding an additional psychiatric residency slot. In addition, we want to create a mental health and substance use disorder education center focused on increasing the number of professionals, practitioners, and peers working in mental health and substance use disorder treatment. We cannot meet the needs of our community without paying attention to our workforce, and we hope to make it happen this session. And with that, I'll yield my time to my testifiers.
Thank you, Chair Bang. First we have is Executive Director Sue Abderholden, if you'd like to introduce yourself. And I'll let the committee know that we've got a hard stop in 10, so at 1:45 I will be taking the vote. Go ahead.
Thank you, Mr. Chairman. Member Sue Abderholden, Executive Director of NAMI Minnesota, and here on behalf of the Mental Health Legislative Network. I was just going to briefly go through some of the sections of the bill that maybe you weren't so aware of. One, again, sections 1 through 2 is making sure that we can work hours out in the community and not necessarily within clinical walls to count for the MERC program. We recognize that mental health professionals have to obtain a certain number of supervised hours before they can become licensed, and during this period of time, they would now qualify for the loan forgiveness program. Section 5 adds another psychiatric residency slot. Section 6 you're going to hear more about, but I just want to remind people that President Eisenhower's seminal mental health report noted that we had a shortage of child psychiatrists, so we've known about this for a long time. Section 7 continues the funding for the program that pays for the education necessary for a BIPOC or underrepresented community to become a supervisor. I will say that since this program passed in 2021, we saw 215 mental health professionals go on to be able to be supervisors, which I think is really great. And that will lead to about roughly 400 students being able to get supervision. Section 8 is the new idea to create this center within the Department of Health. We actually looked at Nebraska as a model whose legislature did do such a thing, and what they saw that in 10 years the number of providers increased by 39%. So by having an office that really focuses on this issue, it can be effective. Section 10 is really the grow your own approach, so someone who's already working in the field, helping them get a master's degree. Section 11 is training for people who work with youth. We obviously need a lot more people working with our youth, but we also want to make sure that we are training them in a way that makes them be most effective in reaching these children. And then Section 12 increases the fund for the loan forgiveness program, which we know has been very effective. So I really want to turn it over to the people who have been most impacted by these programs, but I just want to say that the things that we have done, thanks to your leadership and to your support, have actually worked, and we need to continue to build on them. Thank you.
You're welcome. Thank you. And next we have Bahua Yang, and I apologize if I messed up on your first name.
You're correct, Mr. Chair.
Oh, thank you. Welcome to the committee. Thank you for being here. Please introduce yourself and begin your testimony.
Yes, good afternoon, everyone. Thank you, Chair Fisher and committee members. My name is Pahua Yang. I'm the Vice President of Community Mental Health and Wellness at the Wilder Foundation. I'm here to testify in support of Representative Vang's House File 1436, addressing mental health care workforce sustainability. But before I talk about that, if you're wondering what type of provider, what kind of creature CMIG produces, which is the previous bill, I am one of them. So I am living, breathing proof that we support good providers. I went from being a participant in CMIG to being the person who ran CMIG for my organization to being vice president. The Wilder Foundation is a community mental health and substance use disorder treatment provider and a certified community behavioral health clinic, or CCBHC. And part of our work has focused on being reflective and responsive to the individuals and the families and communities that we serve. It's our strong belief at Wilder that our providers and our leadership must reflect the people and the communities that we serve. We also know that how we show up as a service provider and as an employer in our communities are equally important in moving the needle for the people throughout all of our communities. This is not just about doing the right thing as a provider. Honestly, it's also a smart business decision. The work comes with lots of challenges: financial, sustainability, and human impacts. In this national workforce crisis, our mental health system is competing to attract and keep workers in a field that can be at times stressful and usually under-resourced. We have additional opportunities in front of us to take a multi-pronged approach to addressing both the sustainability of the system and our ongoing workforce challenges. I won't repeat the things that Sue has already talked about, but know that this is really, again, about bringing more sustainability to the system so that we can attract and retain good talent who want to do all the right things for our communities. We also need to be able to expand our MERC dollars to include training providers outside the physical clinic facilities. Minnesota and our entire state our entire country has moved to providing treatment to people beyond the four walls of a clinic, to serving people in places that make most sense to them, such as in the community, in schools, in homes. And we have to update how we support clinical training in order to catch up with what we are actually doing in practice now and into the future. Over 20 years ago, we began talking about the workforce shortage that we were soon going to face in the mental health and SUD treatment field. And despite many collective efforts, we've discovered that we haven't done enough. I want to applaud Representative Vang and many of you in this room who have worked so diligently to move the needle on workforce issues these past 2 years. We need to ensure that this critical work continues to live and is sustained beyond any of us in this room. Investing in an education center dedicated to growing and supporting our mental health and SUD workforce will add to this long-term sustainability. And hopefully in another 20 years, we'll be having a different conversation about the whole new generation of talented professionals who are advancing mental health and SUD treatments that are new and unique to their time and not the issues that we failed to solve. Thank you so much for your consideration and the support and leadership that so many of you in this room have already provided.
Thank you, Ms. Yang. Next, I'll go to Amanda Schlesinger, and we've got about 2 minutes, and then we'll have to go to the vote.
I'll keep it focused. I'm a child psychiatrist on the faculty of the University of Minnesota Medical School. I'm here to.
If you could also please introduce
Oh,
yourself.
I'm
I
so
apologize.
sorry. Yeah.
Okay, I didn't mean to rattle you there, Brad.
So I'm Amanda Schlesinger, and I'm an assistant professor of child and adolescent psychiatry at the University of Minnesota Medical School. I'm the medical director of the consultation liaison psychiatry service at Masonic Children's Hospital as well. So I'm here to voice my support for this bill, which will support important initiatives for addressing our state's mental health care needs. So at work, I see youth in crisis every day. So every day, I think about ways we can deliver better care more effectively to the people who need it most. And one of the best ways we can do that is in the primary care setting, with the regular providers families know, trust, and see regularly. And this is where mental health concerns are often mentioned first. 90% of children in the U.S. regularly see primary care. However, primary care providers don't always feel ready to address and treat mental health problems compared to other medical issues because their training doesn't necessarily include deeper experience in mental health care. Faculty like me trained in psychiatry and psychology want to join more in training our primary care clinicians to handle their patients' mental health needs. There's a serious shortage of child psychiatrists. We can't have enough of me. We want to share our knowledge base more effectively with frontline providers to get care to kids faster and train a more confident pediatrics workforce. So several years ago, there was a working group created that I joined at the university. It brought together faculty from psychiatry, family medicine, nursing, and pediatrics. We were very fortunate to get grant funding for an initial pilot program in 2020. We embed psychiatry and psychology faculty directly into primary care clinics to teach mental health skills to future pediatricians, family practice doctors, and nurse practitioners in real time as they see their patients. We work alongside their other faculty teachers, so as they learn about asthma and infant nutrition, we also teach directly about depression treatment or resources for ADHD. So they get coaching directly from a specialist to rapidly improve their comfort and confidence in this area. The funding outlined in this bill would allow our program and program like ours to continue to expand and improve to better meet the needs of Minnesota's youth. Additionally, as faculty in the larger Department of Psychiatry want to advocate for the funding of an initial psychiatry residency position included in this bill. Psychiatry is an increasingly competitive specialty, and we have far more wonderful applicants than we can match into our existing slots, and doctors who train here often stay and practice in Minnesota, increasing our young workforce. Thank you very much.
You're welcome. Thank you for your testimony. With that, I'll renew my motion to refer House File 1436 as amended to the Human Services Finance Committee. All those in favor signify by saying aye. Aye. Opposed, say nay. Motion carries, and House File 1436 as amended is referred to the Human Services Finance Committee.